Okay, we have time for one more question. Okay, let's see here. I know there are separate indicators and objectives specifically for children and youth with special health care needs. But does the adolescent outcomes focus area and objectives, etc., include all youth or minus those particular youth?
Cherie, this is Trina. Is that clearly that children and youth who have special health care needs make up a very, very important group of young people in our country. It's estimated that up to 20% of all young people in our country have some type of a chronic health condition or some type of... In looking at the objectives that were formulated by the Disability and Health Work Group, the Adolescent Health Work Group actually worked in collaboration with that work group to develop a new objective, which we decided would be better placed in that work group on the whole arena of transition. And that means the transition from a pediatric source of care to an adult source of care. And so that as young people become adults, is that they really need to be seen by adult providers who themselves have expertise in the developmental issues that young adults have, as well as in the expertise needed to address whatever the chronic disease or disability happens to be. That is probably the only unique objective in all of Healthy People that focuses on young people with disabilities. However, an objective that the Disability Work Group had for Healthy People 2010 and continues to have for Healthy People 2020 is that the data template for every objective needs to include the category of disability status. And they are probably being very, very successful in kind of a stealth measure of our being able to measure for virtually, or at least at this point for many of the Healthy People objectives, whether or not disparities exist for people who have disabilities who do not have disabilities. And so, for example, like when I had talked during my formal presentation about the adolescent wellness visit, is that one of the template pieces of data that we know is whether the young person has a disability or whether that young person does not have a disability, and are there differences in their actually having an annual well checkup.
Thank you, Trina. This concludes our Q&A session. I'd like to thank everyone who submitted questions and participated in the session. I'd like to also remind you to please respond to our survey about your experiences with the webinar. As I mentioned before, your feedback is invaluable to help us improve future Healthy People 2020 webinars. And now I would like to invite Carter Blakey to give closing remarks. Carter?
Thank you, and thank you very much to all of our participants and our speakers for participating in this afternoon's webinar. It took a tremendous amount of planning and coordination, and I'm delighted to see that we had, I think at one point, about 600 participants on the webinar. This is tremendous. There was a great deal of important information shared this afternoon, and I'm hoping that it will give our participants a launching pad for becoming more engaged with Healthy People 2020, and particularly with the adolescent health objectives. I'd like to remind you that this webinar is a part of a series of Healthy People webinars that we hope you will attend. Our next webinar is scheduled for Friday, December 16th from 2 o'clock to 3 o'clock p.m. Eastern Time. It'll be a first for Healthy People in that it will deal with the Healthy People 2020 Leading Health Indicators App Challenge. So to receive notices about upcoming webinars and other events, please sign up for our email announcements on the Healthy People website at healthypeople.gov. You can also check healthypeople.gov for a recording of today's webinar. And for our August webinar, recording and materials on healthcare-associated infections. So again, thank you all. We appreciate the hour and a half you spent with us this afternoon, and we hope that you'll return for future webinars.